Almost every one of us is going to feel back pain at some point. Sometimes it's a mild nuisance. Other times it's a full-blown nightmare that keeps you awake. The curious thing is that it doesn't always hurt the same, nor does it always come from the same cause. Sometimes it's brief and tolerable, other times long and relentless, and the reason can range from a tense muscle to a herniated disc pressing on a nerve. Today I want you to see this clearly, without the fluff. We're going to walk through the spine, that remarkable column of bones, discs, nerves, and muscles you carry every day. And I'll show you the spots where things typically go wrong. Understand the source, and the mystery shrinks. So get comfortable, because what you'll learn today can help you for life. So let's begin. Look, the spine, or vertebral column, isn't one giant bone. It's a string of separate pieces fitted together like beads on a necklace. Each bead is a vertebra, and they're not all the same. The spine is organized into 5 regions. Think of them like neighborhoods, each with its own character. At the top is the cervical region, the neck. 7 bones, labeled C1 through C7. C1 holds your skull like a little pedestal. C2 lets you shake your head, no. Handy, right? Down to C7, that one you can often feel at the base of your neck. Simple so far. Below that is the thoracic region. 12 vertebrae, T1 to T12, which connect to the ribs. These bones are bigger and sturdier because they bear more structure. They were the rib cage as neighbors, after all. Those top 3 regions, cervical, thoracic, and lumbar, are the mobile part of the spine. And mobility is great. You can twist, bend, look up and down. But here's the trade-off. Where there's movement, there's vulnerability. More movement means more wear, more tears, and more opportunity for injury. Makes sense, right? Lower down, the spine changes character. The sacrum used to be 5 separate bones, S1 to S5, but during adolescence they fuse into a single solid block. Same with the coccyx at the bottom. Several tiny bones fuse into the little tailbone. Don't underestimate them. A bad fall while sitting can make you remember the coccyx in a hurry. Why does this structure exist? Well, the spine has a few big jobs. One is protection. The vertebrae form a tunnel, the vertebral canal that shields the spinal cord, the body's main wiring. Look at any vertebra and you'll see a hole through it. Stack them and you get a protective tube. Another job is load-bearing. The front portion of each vertebra, the vertebral body, is like a weight-bearing block. It transmits force up and down the skeleton. Between those blocks sit the intervertebral discs, little shock absorbers. They let you move and absorb pressure so bone doesn't grind on bone. But those discs aren't invincible. Over years or after a bad move, they can degenerate or get injured. That's when herniated or bulging discs show up. A disc can bulge out and either hurt directly or, even worse, press on nearby structures like nerves. And when a nerve gets irritated, the pain is different, sharp, electric, traveling along the nerve's path. Ouch! Picture the foramen, the tiny exit tunnel on each side where a spinal nerve leaves the spinal canal. If that tunnel narrows, say because the disc collapsed or the vertebrae changed shape, the nerve can become compressed. The result can be pain, numbness, tingling, even muscle weakness. Ever felt a shooting pain down the leg? That's often the sciatic nerve. The sciatic is the largest nerve in the body, formed by contributions from several lumbar and sacral levels. When a disc in the lower lumbar region, especially between L4-L5 or L5-S1, herniates and presses on those nerve roots, you get sciatica, sharp pain down the back of the thigh, into the calf, sometimes reaching the foot. It can also bring pins and needles or weakness. Not pleasant. Another frequent culprit is osteoarthritis. Yes, the same kind of wear and tear people get in knees or hips. In the spine, this affects the facet joints, those little joints at the back of each vertebral level. They're lined with cartilage, and when that cartilage breaks down, the joint becomes arthritic and painful. Facet joint arthritis tends to cause localized pain and stiffness, and certain positions or motions can make it worse. Age, of course, is a factor. So is prior injury. A whiplash in the neck can predispose someone to earlier facet changes, small joints, big consequences. And then there's the everyday muscle pain, the one most people blame on throwing out their back. Deep back muscles, the erector spinae group, multifidus, semispinalis, are the true stabilizers of your spine. They aren't just pretty strips you see in a gym selfie. They're dynamic supports that keep each vertebra in position. When you lift poorly, twist suddenly, or sit with bad posture for hours, those muscles overload. They can spasm, tear tiny fibers, and become painfully tight. That's the classic pulled or strained back. It can feel like you're stuck in place because moving aggravates the pain. People will say, "I tore my back." Many mean a muscle strain. Dramatic words, but real mechanism. Overstressed contractile tissue. Here's something important. You can have more than one problem at once. A bulging disc, an irritated nerve, tight spasmed muscles on top of it all. It's like a traffic jam where every lane is blocked. I've seen patients with a combination of disc bulge compressing a nerve, arthritic facets in the same spot, and surrounding muscles in spasm. Multiple issues, multiplying your discomfort. That's why careful assessment matters. So, what do you do about it? The good news, many back problems improve with time and supportive care. Not always quickly, but often yes. Conservative measures include relative rest, not bedbound for weeks, just moderate activity, heat to ease muscle tension, therapeutic massage, and targeted exercises to strengthen and stretch supportive muscle groups. Physiotherapy is gold. Over-the-counter pain relievers, ibuprofen, paracetamol, can help control symptoms. Muscle relaxants sometimes are used if spasm is severe. If these measures fail, there are intermediate options. Injections of anti-inflammatory medication around irritated nerves, facet joint injections, or procedures like radiofrequency ablation, where a small nerve that transmits pain from an arthritic joint is intentionally disrupted by heat to reduce its signaling. And yes, when there's persistent nerve compression or a severely damaged disc that doesn't improve, surgery may be the best way to decompress nerve structures and stabilize the spine. Remember, not all back pain is mechanical. There are less common but important causes. Fractures, especially in osteoporosis, tumors invading the spine, or even visceral pain from organs like kidneys or the pancreas that refer to the back. That's why red flags, severe, persistent pain, fever, unexplained weight loss, or loss of bladder or bowel control require urgent medical evaluation. Don't shrug those off. At the end of the day, your spine is the central pillar of your body. It supports you, gives you movement, and shields critical nerves. So care for it. Move smartly. Learn safe lifting techniques, strengthen your core and back muscles, keep a healthy weight, and listen to your body when something feels wrong. Knowledge helps you make better choices and seek help when needed. Thanks for staying with me through this tour of the spine. If this helped you understand what might be causing your back pain, please subscribe and hit the bell. It helps us make more clear, practical videos for you. Remember, information is power, and in medicine and anatomy, that power can change your life. Take care, keep learning, and I'll see you in the next video. Blessings.